Hi, this is your Houston chiropractor, Dr. Gregory Johnson. We got Gabriel down here with us this morning, all the way from Chicago, Illinois. And Gabriel has already seen, how many chiropractors did you say?
I lost count, 7 or 8 already.
And Gabriel comes in here complaining of some thoracic spine pain that radiates around both sides out into his rib cage. And he's had the gallbladder removed because they diagnosed him as having cholecystitis. And that was back in 3 years ago, I think, wasn't it?
No, a year ago.
A year ago, yeah. So he had his gallbladder removed, but interesting enough, he got the same pain down in his lower left rib cage, or right rib cage there, that he had when he had the gallbladder removed. So it probably wasn't his cholecystitis that was the cause of this pain if he's still getting that same pain as a result of radicular pain from his thoracic spine rib cage area. He gets neck pain and stiffness, worse on that left side, headaches, dizziness, low back pain and stiffness, cramps down into his feet. But he's also been suffering from some acid reflux GERD symptoms, right?
Yeah.
That you've been diagnosed with. We don't really treat acid reflux, hypohernia, or GERD here, the disease, but we do treat the biomechanics of the thoracic spine rib cage. And he doesn't really complain or have any history of trauma or accidents that's significant. He has been adjusted as recently as 3 weeks ago, and it did help him with his symptoms at that time. So this would be his very first adjustment here at our office, and I'll let him tell you the difference between my adjustments and what he's received so far. So let's go ahead and have him check your posture on this next one. Gabriel, I want to have you close your eyes again and bend your head forward and backwards again for me. Now see, when he goes forward, that pulls right in there a little bit, huh?
Yes.
And when he goes backwards, it kind of kinks up on that lower left side. So his head's forward and translated to the right. He brought his x-rays in too, by the way, which we looked at. Cervical and lumbar x-rays, full spine x-rays even. 14 by 36, you don't see those too often anymore. His pelvis is translated off to the right, his head's forward to the right. It's also rotated though to the left. That's interesting little thing. Is that the way you turn most of the time when you're sleeping?
Probably, yeah.
Okay. So we're going to lay you back on your stomach, Gabriel, on this table, and I'm going to adjust you on this table first today. On first time adjustments on my new patients, I always suggest them on the BioPhysics table first, just because I get a feel for their spine that way. Now his leg length is short on the left side by 1/4 of an inch in this prone position. When I bring his legs up, however, that gets even and that tightens up in his low back. So that's a positive Deerfield on the left, which indicates sacroiliac subluxation. Positive Knockless test for pain in the lumbosacral region. Palpating, he's got bilateral SI joint subluxation. So I'm going to start off with this left one. I get a contact right on the medial aspect of the posterior superior iliac spine. And I just do a internal to external x-axis adjustment plus a y-axis adjustment on these joints. And then sacrum, I'll hit right, center, and left sacrum straight superior to inferior and z-axis as well. Looky there already. Got his legs evened up. Gabriel, tell me if this feels any easier yet.
A little bit.
Okay, so I haven't adjusted his lumbar spine. That was just with his pelvis. Now I'm in the lumbar spine. My contact here, right in the center of my palm, Doc. Straight PDA. Adjusting as I move up into L2 and L1, I to S and PDA. Yeah. You got some definite adhesions down in that lower thoracic there, Gabriel. See if this tightens up any less this time.
Yeah, a little less, yep.
So, most of his knockless was coming from his lumbar spine, which is also what showed up on his x-rays. There we go, good. Okay, let's turn you into back, please. A little deeper in person, huh, Gabriel?
Yes, it is.
So as a chiropractor, it's important to correlate subjective information with objective information. Objective being x-rays, exam findings, things like that, along with their subjective complaints of symptoms. So bring your head up and over your spine. You do this psychomatic adjustment. Slide down this way about an inch. Put both arms out, palms up. Adjust your shoulders, your clavicles, and your anterior ribs. There we go. You notice I don't really take it easy on people. Get your hands right there for me, Gabriel. Take a deep breath in. Exhale. Keep blowing air out through your mouth for me. I'm going to pull down on the fascia here in your abdomen, which will help realign that lower rib cage. Okay, again, deep breath in. Exhale. Yep. And one more time, please, sir. Keep exhaling for me. Has anybody ever done this to you before?
Yeah.
That deep?
Yeah, no. Yes, but no.
Okay. Let this right leg go into my hands here, Gabriel. There we go. Whoa. Should have felt that from you all the way up to your lower back.
Yes, I did.
Good. Same thing here. Let me have this one. There we
Whoa.
go. Super duper.
Yep.
All right, let's sit you up, face towards your knees. There we go. It's worth mentioning too, Gabriel's a long-term crack addict from Chicago.
Yep.
Watched our videos for, it said like 5 years?
Yeah, something like that.
That's
3
pretty
to 5
good.
years.
All right. And he's been to some other YouTube chiropractors too, right?
Yes.
I won't mention any names, but
No.
very good. Okay, let's come over here on this table next. Well, yep, see, he already knew the position, huh? No, you're fine. You got a front row seat right there, Denise. Slide up this way about an inch. I'm gonna raise your legs up at this table. Maybe about another inch, Gabriel. Okay. You can rest your hands there. Now, the pin placement, Doc, is just right above the iliac crest bilaterally. And you get them in there good and tight, too. The tighter the better, because you don't want them sliding through there. Okay, you want to keep your teeth together on this adjustment, Gabriel. Don't bite your tongue. Breathe through your nose with your left ear. There it is. Yes, sir. Oops, sorry about that. Should have felt that one all the way down. I'm pretty sure you did, because I did.
I did.
Yeah, cool. Let your head go in my hand. Yes, sir. So on the cervical adjustments, there's some of a rotary movement in there with the Palmer diversified rotary brake. However, a lot of this adjustment is P to A or posterior to anterior thrust as well. You didn't scream near as loud as I thought you would. Welcome to Advanced Chiropractic Relief. Let me help you up sideways now, Gabriel. Yep, there we go. All right, let's stand over here in front of the mirror now. Well, look how your shoulders squared off already. See your posture changed immediately? Your pelvis is not so far right now either. Your head's right down the middle too. Just gonna bounce these muscle spindles with this instrument. This will help relax your paraspinal muscles. And then here's your homework right here, Gabriel. Hold those shoulders up and back. Bring the head straight back and then look back. You'll feel a little tap on your atlas there. And there, now relax. And when you go forward and backwards again, it should feel easier to do it this time, but you tell me.
Yeah, a little easier. Smooth.
So you got your very first ring dinger today. Being a crack addict, watching this for several years like you have, how would you describe your first experience here at our office to the rest of our crack addicts worldwide.
It's definitely deeper, I can't even person, deeper in person, and yes, you do feel the difference with, everything. Yeah.
So how did my adjustments compare to the chiropractic adjustments you've already had?
I guess, like I said, just the thrust, and it is deeper in person. The ring dinger was definitely,
The real deal, huh?
It's the real deal, so it's, it's good.
So how do you feel right now compared to how you walked in the door?
Feel a little sore.
You're going to be sore for about 72 hours. We always tell our new patients they're going to be sore for about 3 days, which is 72 hours. Because we're tearing loose adhesions and fibrotic scar tissue that develops in and around the vertebrae of the spine and the joint. So, a lot of that's just chronic stuff that we're breaking up and got to get that moving properly again so that we can make the vertebral motor units function the way they're supposed to in their range of motion, and then free up the neurology to function the way it's supposed to. How'd your tummy feel right now?
Right now it feels good. You definitely did go deeper in that.
Pulling it down.
Pulling it down. I had another chiropractor do it. It wasn't as deep and wasn't as
effective,
wasn't as focused. Like it was, it was more specific in that area you were at. He kind of went around it, but no, yours was definitely much deeper and more specific. And
so Gabriel's going to be here with us for 3 days, and he's getting adjusted twice a day today, twice tomorrow, and then twice on Wednesday. With his permission, we'll do a follow-up on him on Wednesday afternoon to see how you did during these 6 visits, and you can tell him one-on-one if it helped you or not.
Okay, sounds good.
Very good. This is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief in Houston, Texas, with Gabriel from Chicago, Illinois. We'll see y'all soon.